Now stay tuned for Focus on America, where we bring you the latest in educational, consumer, sports, and business information that's right for your lifestyle.
Welcome to today's Focus on America. I'm Wayne Stavsky. Since its founding in 1982, the National Hospice Program has helped hundreds of thousands of chronically ill people and their families. From nursing and physician care to mental, emotional, and spiritual support, approximately 200,000 people benefit from hospice care in the United States. Joining us today from his office in Hanover, Pennsylvania, is Dr. John Lunsford, Medical Director for AseraCare Hospice in York and Adams counties in Pennsylvania. Dr. Lunsford, welcome to the program.
Thank you, Wayne. It's great to be here today.
What are some of the misconceptions about hospice care?
I think the greatest misconception about hospice care is that a patient has to give up hope when he becomes a hospice patient. In actuality, that's the farthest thing from the truth. Patients in hospice have lots of hopes, have lots of dreams. One of the roles of hospice is to help embrace those and to help realize those dreams. Patients have hopes that they can die with minimum or without any pain. Patients hope that they can be taken care of, surrounded by loved ones, perhaps even in their own home.
How do you determine who is eligible for hospice care?
The definition would require that a patient be within about 6 months of their death for Medicare and Medicaid to pay for the services hospice provides. Generally, family and patient will know if a patient is losing weight, if a patient is having trouble with their usual activities, walking, bathing, enjoying life. If these areas are getting more and more difficult for the patient to participate in, then very likely they could be a hospice candidate. Many times when a hospice organization surrounds that patient and family with the services they need, the attention they need, patients actually sometimes thrive and do better. For this reason, many times families really will exclaim, "I wish we had known about hospice services earlier."
Hospice care places an emphasis on the quality of life rather than its duration. The mission of AseraCare Hospice is to affirm life, emphasizing dignity and comfort while enhancing the quality of life for its patients. And joining us now is Mandy Lucas of AseraCare Hospice. Mandy, does the care that you give substitute for the care that the patient's family gives?
The care I give actually enhances the care that the family gives. During this time in a family's life, they're not they're trying to cope with the illness, and then they're also trying to cope with how they're going to take care of this person. And we really come in and we just help them to understand how to do things such as bathing and helping them get up and down the stairs. It's not just myself, but we have a whole team that will help them spiritually. We have social workers that help them through any needs that they need in that respect. Home health aides that come in and help supplement some of that care for them as well.
As a caregiver, what aspects do you feel are most important in providing hospice care for a patient?
I think the most important thing to providing care for our patients is good communication with the family, with the physicians, communicating the needs. We are the ears and eyes for our patients and we advocate for them, and also communicating to our team. If it's something that from a nursing perspective I can't handle, there's somebody on my team that can.
The people that make up AseraCare Hospice are passionate about their work and are dedicated to providing comfort and dignity to their patients during their final weeks, days, and hours of life. Joining us now to tell her story is Olga Singleton, wife of hospice patient Joseph Singleton. Olga, tell us of your family's experience.
It's a wonderful organization. The medical staff, they are awesome. They come in with a smile and they go with a smile. They take his vital signs every day and make sure that he has his medication. And if he runs low, they have the prescriptions refilled. They took the burden off of my shoulders because I do take care of him. He's taken care of me for all those years.
Olga, thank you for sharing your story with us. And my thanks to you, Mandy and Dr. Lunsford, for your insight into the hospice program as well.
Thank you, Wayne. It's been our pleasure.
And if you'd like to learn more about AseraCare Hospice, or to see if you or a loved one qualifies for hospice care, or to volunteer, you can visit AseraCare online at www.aseracare.com. That's all for this edition of Focus on America. Thanks for joining us. I'm Wayne Stavsky.